My name's Kim. I'm a support facilitator for Partners in Recovery at Institute of Urban Indigenous Health, when you're on the team, as you found out this morning. I'll be keeping time, making sure everyone sticks to it. So first up is Anne-Marie O'Brien from Neami National.
I'm actually Anne-Marie O'Brien from Neami National. Some people say Nemo, some people say Neami. Believe it or not, we were named after an organisation in Melbourne that was the North East Area Mental Illness Service, okay, way back 25 years ago in Preston. Sooner or later, calling it North East Area Mental Illness Service sort of blend into Neami, and because it's a national company, national organisation, we all say Neami National. Okay, so systems reform. Well, us supports facilitators have been really busy actually trying to work with people, but we have this lead agency that keeps saying to us, you're supposed to be changing it all as well. So fortunately, they've been very gentle with us, and they allowed us to actually work with people first so that it became clear what the actual system reform issues were. Like any of us, if you put us in a room, we'd come up with some. But it was even better if we actually looked at the lived experience of people, what were their barriers, and then come to an idea as to what system reform meant. So even within the 12 months, my passion for system reform has moved from the NDIS to something else. But I have been informed by the lived experience of one of the men we support, and it is now currently DVA, Hospitalisation and Mental Health. Which button? Okay, Department of Veteran Affairs. It is a federally funded bucket of money, and it is used to look after those members of our community who have been part of the armed forces, who've served their country, and are entitled to be supported in their life afterwards. So we have what's called a gold card. Have people heard of the War Vet Gold Card? Yeah. So the Department of Veteran Affairs funds people to receive medical support to enable them to have good lives as they've returned from action. The problem is that DVA is very much in a medical type of framework. So when you have a look at what DVA will offer, they will offer general practitioner services, specialists, allied health, dental, community nurses, spectacles, hearing aids, care in public and private hospitals, home support services like domestic support or personal care, subsidised pharmaceuticals, and they'll also offer some counselling at the Veteran and Veterans Families Counselling Service, and we have one of those in Brisbane. So you can imagine my dismay. Oh, wait there. What do they cover in mental health? If you've got a gold card or a white card with a mental health condition, then a wide range of mental health treatments are available to you, including GP, psychologists, social work, occupational therapists, psychiatrists, or hospital services. They also understand that there's certainly people with complex needs, and they have a coordinated veteran care social assistance scheme, which is a 12-week intensive assisting people to socially connect with their community. All good things, but is it enough? So I met this gentleman, and his name is John. He's got this flashy DVA gold card, and he's got quite a very good income as well. So he has a pension that's beyond disability pension, and his money is managed by the public trustees, so that money's been accumulating for quite a while, and he's got a lovely big nest egg there. Has depression, and for many years he's had multiple admissions to a private hospital on the north side that shall remain nameless. So what's his story? He goes for a couple of days, he feels a bit flat, lonely, miserable, admits himself to hospital. 21 days later, he's discharged, and he's lonely and miserable. And what we found when we first met him was he wasn't even returning to the nursing home that the adult guardian had organised for him to live in. He was returning to the laundromat down the road, where he would stay for a couple of nights until he could get back into hospital. Okay, so first up, when he came to PiR, we assisted him to get more appropriate accommodation. So he's now got a lovely little unit, but he is still spending more than 50% of his time in hospital. What support is he eligible? So we did a whole lot of assessment trying to get DVA to be able to support him. And he's either available is a hospital admission that costs about $1,100 per day, or he can get half an hour a week of domestic support and the ability to go and see a counsellor once a month. So there's the gap. Okay, so there's the gap. So we are paying at least $25,000 every time he's in hospital. As soon as he's discharged from hospital, Hendicare has the contract to come, I think it's actually more once a fortnight, but to come and clean his house, and then he can go into Brisbane to see the more vet counsellor. So there's a big gap here. So I started looking, so ringing, is there any chance that maybe we could get some support workers in with him? Oh, no, we don't do that. But how's he with his showering? Yeah, showering's fine. But we really think if we could just have somebody come and see him every couple of days. What about the suggestion was to go to RSL and see if you get a whole lot of volunteers that were going to go to this man every day. Lovely idea, but it just didn't come together. For example, this gentleman not only costs us this amount of money when he's in hospital, but recently when he was at home, he felt a bit low. He rang every service, said he was putting the toaster in the bath. 3 police cars, the ambulance and the fire brigade all turned up, and he was left in his unit. So he wasn't actually even admitted. But then, a couple of days later, he went and spent some time in Belmont and then came back and spent some time in Pine Rivers Private. So it's a cycle that's going on and on and on. There's an unknown number of DVA recipients that spend many months in hospital for mental health issues. When they're discharged to the community, there's no practical mental health support available within their home or their local community. And I asked the question, would DVA be interested in offering a community-based mental health service to these clients? I asked and no one was interested. And so there's this theory about it is better to seek forgiveness than to ask permission. And one moment in absolute frustration, I'm sitting at my desk at work and I send an email to the Minister of Veteran Affairs in Canberra. And then I press send. And then I said to my boss, oh my God, I think I just emailed the Minister for Veteran Affairs in Canberra. And it was a cheeky email, something like, do you want to save some money? See here. And I just explained the situation. And my boss said, I want to see that email. And I said, oh, no, you don't want to see that email. I want to see that email. If anyone talks to me, I need to see the email, what you do. So anyway, I showed her the email. She said it wasn't that bad. But the phone rang. And it was the Minister's office saying, we want to talk to you about this. This is an issue that we are starting to flag. We actually haven't done an audit around hospital admissions for mental health for people, but we really would like to have a look in this space. So that's where we're up to. Okay, so the idea being that we're going to... So the plan is to trial, even if it's just around this one gentleman. I know that there's a few others, and private hospitals are doing a fantastic job, but are they particularly interested in getting people out of their hospital? Not necessarily. So it's not going to be that they may come on board. They're certainly interested in hearing about it, but it's really got to be something coming from the community that says, if we can just use some of your DVA money, which is taxpayers' money, to maybe support this person, to put in 24 hours staffing, using an agency, costs about $670 for 24 hours, okay? $1,100, that's not even including the doctors, and that's not including, any of the extras if there's tests or whatever. That's just his bed, board and food in the hospital. And I believe in the public hospital, some of the situations are $1,600, so we're talking a lot of money for a 24-hour admission. It leads us to really be motivated to see the cost effectiveness of doing something for half the cost, a quarter of a cost. This gentleman would just really appreciate a 1 hour pop in. How you going? Did you eat anything today? You're heading over to that, relaxation class. How you going with your food? That would be a lot cheaper than having him in hospital for weeks on end and then coming out to just return. So the lessons, be cheeky. No, don't always be cheeky because that'll get you in a lot of trouble, okay? But, it's a good point because I thought the dollar number would actually talk well to DVA, but they're actually very interested in the quality of life of the person. So I'm always just sort of saying, hey, it's going to be cheap. And I said, it's not about being cheaper. You know, this man's getting institutionalised, he's got no natural supports, he's now got a nice little unit. Look, we're interested in seeing if we can do something better. So watch this space. Thank you. Oh, any questions? Does anybody know any other DVA recipients that can come join the party?
Just a question for me is that, you know, it's not just DVA, we're talking about insurers here, you know.
Yeah.
There seems to me to be a realm of an area where we really need to be exploring it, because they're insuring people going to hospital to, you know, and I'm sure they're doing exactly the same thing.
And that's actually where we started, because looking at insurance companies as well, because once again, when you look at your list of what's covered when you have top hospital, it may be mental health social worker, mental health psychologist, but often not a recovery program or some sort of support work type program that would actually help you get out and do things. So that's where it started, and none of them wanted to talk to us. So we then thought, well, we'll start with DVA and see what we can do. Look, that, you know, this sort of sounds like, for DVA in particular, you know, this is taxpayers' money. So just like we have money in the hospital, public hospital systems, where we're questioning how we can use it better, then this DVA money is, you know, citizens' money, and I'm sure we would all prefer someone getting a minimal amount of support in their own place to actually get out and do things than to be spending long time in hospital. The other thing that has happened, which really has changed for a lot of war vets, is that some of the private hospitals are being used by immigration services for refugees who have mental health issues. And for every refugee that comes into these private hospitals, they bring their own security guard. So his returning to the hospital as well, he's met with a hallway filled with security guards guarding people's rooms. So it's not even becoming such a therapeutic environment for someone who's got war memories to have security guards everywhere within what they thought was a safe space. So it's certainly worth looking at. We've got a number of other systems reforms processes also happening with Neami. One of the ones I would like Phil to just talk about a bit, it affects us all, and it's the homelessness count in Moreton Bay Shire. So, hey? Well, yeah, so have people heard about the homelessness count that's happening? Okay. Yeah, it's a pretty important initiative. QCOS has been funded to come and get some real figures in the Moreton Bay Shire as to how many people are homeless, and if they're homeless, we can guarantee that 80% of them have got mental health issues. So these are our people that they're wanting to count. Phil has been on some of the planning. I'm sure there's some others in the room that might be involved with it, but come up and at least say what we're doing. We've got a barbecue happening in Pine Rivers. We've got things happening at Caboolture and Redcliffe, all happening the same sort of week, so we can get a snapshot of how many homeless people there are in our sector.
So it's funded by the Department of Housing and driven really by QCOS, because they saw the need to get some data around the local government area in Moreton Bay. I went to a meeting that convinced me that I should really do this, because I went to a meeting with the Deputy Director General of Housing. I can't remember his name, but that's what happens sometimes. But he said, we know nothing about homelessness in the Moreton Bay local government area, and that convinced me that, you know I live at Redcliffe. I go down the front, there are people sleeping in cars. I know that the Breakfast Club has many people going there and getting meals, so there's lots of homeless people, we know that, okay? So because of that, I decided to become involved, and really all it is about, we're going to count the people, okay, that are homeless, or try to count them. So we brought a whole lot of community organisations together to try and do just that, and so there's stuff going on all this week at Caboolture, at Redcliffe, at Strathpine. Next week we're running a barbecue just to try and connect with the rough sleepers around the Pine Rivers area, which I know from experience with some of the homeless people we're working with, there's quite a number of people there. We know that there's people over at Redcliffe and so on, so the Breakfast Club and other agencies are going to be working there and they're having barbecues and so on. Last night I went to a barbecue at Caboolture at the lakes there, and there were about maybe 70 or 80 people there getting free food. That's a regular event on a Tuesday, and we did probably 8 surveys there. and talked to another probably 13 people who said, oh no, I don't want to do the survey. Okay, so we've really identified 20 people there at least, but 8 that we've got a lot of information about, and this is really important because the information is this SPDAP, and it's really intensive, it's really thorough. There's 100 questions in the survey. It takes maybe 15 minutes to do it properly, to talk to people and to get that information out, and it's going to be hugely important once we collect that data and we start going, gee, we really want to house this person, and we've now got a tool that says this person is going to be the highest priority because this person is going to be at risk of death, and that's what it's based on. That it's based on the idea that these combination of circumstances, this person most likely to die out there homeless, okay? And so with that information, and housing is going to have it too, so I think that we're going to actually come together and try and work together as a community with housing to house these people. And we don't know how many people there are in this area, but that's the hope for outcome in the future. And I guess the exciting thing for me was last night I went to this thing, and I hadn't done this for quite a while, haven't done any surveys or anything, but I kept saying to the people that I was working with and filling in the form, I was saying, my name's Phil, don't forget, because I'm going to sit on the committee that's going to try and drive this program forward, and you're one of the people that I'm going to be working for to do, so don't forget my name, because I know your name, and I won't forget. And it's really important to understand this is personal, it's about relationships, and it's about changing, and it's about people in the agencies deciding that they want to get this different, because I don't think people in Australia need to be homeless. Yeah.